I'll be doing Dr. Charette's protocol. I'm going to start with the glute medius test. Okay. Would you hold there? Okay. And that's weak. That's going to be an indicator for the cuboid, the lateral longitudinal arch. And 3 indicators for pronation are going to be positive navicular drop test, lateral and posterior heel wear on the shoe, and patellar approximation. Okay, I'm going to start out with navicular. Okay, and cuboid. Okay, and cuneiforms. Met heads. Okay. Talus. Calcaneus. Phalanges. And fib head. Okay. Okay. Great. Now I'm going to retest the glute medius. Okay, and down. And resist me. Okay, good. Okay, that's about a grade 5. So we've corrected the subluxations for the pronation protocol. Now I'm going to move on to supination protocol. Some indicators are positive, negative navicular drop test, a excessive high arch, also the Achilles tendon is going to bow laterally. Okay, I'm going to start that by doing the navicular and the cuneiforms at the same time here. Okay, cuboid. Okay, met heads. Okay, talus. Okay, calcaneus. Phalanges. And fib head. Okay, great. Okay, now we're going to assess the knee and do 3 possible listings. The possible listings can be a medial epicondyle, lateral epicondyle, or a posterior tibia. Okay, I'm going to have, I'm going to assess the knee. Can I just have your leg? Okay. I'm feeling for movement or sponginess in a certain direction. And I'm feeling that when I push towards medial. So I'll have the patient flip over, please. Okay, and the subluxation is medial. So I'll have the patient flex. Find that medial epicondyle. And I will adjust it to lateral. Okay. Great. And flip over, please. Okay, now we're going to reassess the knee here. Thank you. Okay, and I'm not feeling that sponginess and movement that I did before. so we've adjusted that. I'm going to now test the anterior femur. Would you raise your leg, please? Straight out. Okay, I'm going to push down, just resist me. Okay, and that's less than a grade 5, so we're going to adjust by putting the knee into flexion, making a triangle above the knee. I'm just going to pull it up. Okay, adjust there. Okay, and now we're going to retest by bringing your leg straight up. Okay. Okay, and strong. Thank you. Now we're going to do an alternative talus adjustment. So if you could actually flip over prone for me, please. Okay, go ahead and do it on this foot. So I'll flex the patient's leg. Okay, great, thank you. And if you could flip back over for me, please. Thank you. I'll be demonstrating big toe adjustment and bunion. Okay, thank you. And we're going to assess the patella with the fingertips. Okay. I'm feeling a restriction, so there's a superior subluxation. I'm going to adjust it superior to inferior. Okay, and then we'll reassess. Okay, I'm not feeling a restriction in any direction. Thank you. Yeah.
Okay. Show the muscle test for a possible rotational problem of the hip.
Okay. I'm going to flex your knee. Oh, actually, I'm going to use the TFL test to see if there's a hip rotation issue. Resist me. Okay, and there is. So now we got to see if it's internal or external. Can you flex your knee for me, please? Thank you. Put my hand around this. Just relax it. Okay, and my other hand's going to be on the trochanter. Okay, and I am feeling a restriction in this internal rotation. Now we would check external rotation. Okay, so I need to adjust the internal rotation. I'll come to the trochanter and adjust in a P to A medial direction. Okay, and then we'll retest that with TFL. Strong. Great.
Demonstrate the elements of a wrist extension technique on an empty table, setting the appropriate amount of pressure for each hand on the knee, hip, and shoulder.
Okay. If you could flex both of your legs so I can use the bottom part of the table, that'd be great. Okay, for my non-dominant hand, I want to put 60 to 70 pounds of pressure. And for my speed hand, I want to use 10 to 15 pounds of pressure when we are adjusting the knee. Flex my wrist and bring it together. Okay. Now, if I was assessing the shoulder or the hip, I would use my non-dominant hand with 10 to 15 pounds of pressure, my speed hand with about 10 pounds of pressure. Now I want to do this on the knee. So if you could flip over, please. Okay.
Perform an assessment of the knee, determining the listing. Stating what you found. Stating what you found.
Okay. Go back over. Okay, I'll have you flip back over. Okay. Let me assess the knee. Okay. And now I'll have you flip over. Thank you. Okay, it was spongy when pushing medially. It's a medial subluxation. Going to find that medial epicondyle. Okay. Put my non-dominant pressure hand down and also my speed hand. Okay, and we'll have you flip back over, please. I will reassess the knee. And I'm not feeling movement in the knee.
Perform a muscle test assessment of the hip for an anterior femur.
Okay, for an anterior femur, I'm going to go ahead and keep your leg extended and raise it up. So I'll do the anterior. Okay, using the rectus femoris, and that is weak. Now, to use the wrist extension technique on the knee here, I'm going to find the trochanter and come up 90 degrees into the midline. I'm going to put my non-dominant pressure hand down with about 10 to 15 pounds of pressure and my speed hand with about 10. Okay. And now I'm going to recheck that muscle. Okay, great. Thank you.
Perform a muscle test assessment of the shoulder for an anterior humerus.
Okay, shoulder for anterior humerus. I'll go ahead and use your right shoulder. And arms straight up. I'm going to push this direction, resisting. Okay, and that's weak. So I'm going to come shoulder joint and use my non-dominant pressure hand at about 10 to 15 pounds of pressure. You can't see it. Okay, my non-dominant pressure hand is about 10 to 15 pounds of pressure. My speed hand is about 10. Okay, and then I'll recheck the anterior humerus. Great, strong. And that's Charrette's protocol. Thanks for watching.